Hello my dear friends. Today we are going to discuss about very interesting and important chapter. It is immunity. So let's start to discuss about the portion immunity. Okay. So immunity. What do you mean by immunity? Immunity is the defensive power of the body, protecting the body from various infections. It can be of two types: innate immunity and adaptive immunity. Innate immunity, it means uh, the defense mechanisms that are present since birth and have evolved to specifically recognize microbes. It is also known as natural or native immunity. So what is innate immunity? It means the immunity which is present since birth and have evolved to specifically recognize microbes. Let's go to the another type of immunity, adaptive immunity, also called as acquired or specific immunity. Consists of mechanisms that are stimulated by microbes and are capable of recognizing non-microbial substances also. Adaptive immunity develops later after exposure to antigens and is more powerful. The major components of innate immunity are epithelial barriers like skin, phagocytic cells, mainly neutrophils and macrophages, natural killer cells and plasma proteins. The adaptive immune system consists of lymphocytes and their products like antibodies. It has two components: cellular or cell-mediated and humoral immunity. The former is protective against intracellular microbes, whereas the latter is effective against extracellular microbes. So my dear friends, you can see the chart here. Immune cells, so they are divided into lymphocytes and antigen presenting cells. The lymphocytes are divided into three major parts. It's T lymphocytes, B lymphocytes and natural killer cells. Mainly the T lymphocytes are produced from the thymus and they are helper cells. But B lymphocytes, they are cytotoxic cells, and the third one is natural killer cells. They are mostly emerged in the cancer cells. They play a major role in about to defeat the cancer cells. So we go for the antigen presenting cells. In there is present with B cells, macrophages and dendritic cells. So lymphocytes, they are divided into T lymphocytes, B lymphocytes, natural killer cells, and the antigen presenting cells. They are having the B cells, macrophages and dendritic cells. So let's see about the T lymphocytes. These are derived from cells in the thymus and are the mediators of cellular immunity. They constitute 60 to 70% of peripheral blood lymphocytes and are located in the paracortical areas of lymph node and the periarticular sheaths of spleen. These cells have an antigen-specific T cell receptor. The cells have on their surface cluster differentiating molecules by which they can be readily identified. So it means the CD markers. The CD molecules present on T cells are CD1, CD2, 3, 4, 5, 7, 8 and CD28. So please remember here, 6 is not present there, and you can stop up to CD8 and then CD28. So you can remember CD3 is involved in signal transduction and is known as pan T cell marker. The T cell having CD4 molecule is called CD4 T cell or the helper T cell, and that having CD8 molecule is called as CD8 plus T cell or cytotoxic killer T cell. The ratio of CD4 CD8 T cell is normally 2:1. The helper T cell or CD4 T cell is known as the master regulator of the immune system. So my dear friends, please remember the important points. Helper T cell or CD4 cluster differentiator for T cell is known as the master regulator of the immune system. Cytotoxic T cell or CD8 T cell binds only to antigens presented with class 1 major histocompatibility molecules, so they are called as major histocompatibility 1 restricted. Helper T cells binds only to antigens presented with class 2 major histocompatibility molecules, so they are called as major histocompatibility 2 restricted. So here we go to the next. B lymphocytes. These are derived from cells in the bone marrow and are the mediators of humoral immunity. They constitute 10 to 20% of peripheral blood lymphocytes and are located in the cortical areas of lymph node. White pulp of spleen and mucosa associated lymphoid tissue of gastrointestinal tract. B cell associated markers are CD10, it's majorly known as CALA, CD19, CD20, CD21, CD22, CD23. They all belongs to B lymphocytes. After antigenic stimulation, the B cells form plasma cells responsible for the secretion of immunoglobulins. The antigens are made of light chains and heavy chains. These are classified the basis of the heavy chains into different types like IgG, IgGm, IgD, IgA and IgE. So here in the pictures you can see the T cells are mobilized when they encounter a cell such as dendritic cell or a B cell that has digested an antigen. My dear friends, you can just note down all these diagrams. So important points about the antibodies. These are the main points for the exam. So please listen to me. The IgG immunoglobulin G present in maximum concentration in the human body. So the mostly the human body is covered with the immunoglobulin. It is IgG, important for the secondary immune response, which can cross the placenta. So the IgG are present as the maximum concentration in the human body, and they are important for the secondary immune response, which can cross the placenta. And here we goes to IgA, immunoglobulin A, recent in physiological secretions of the body, present in dimer form joined by J chain. So the J chain is present in immunoglobulin A. This is a major point. The immunoglobulin M, which is important for the primary immune response. So my dear friends, please remember IgG is responsible for the secondary immune response, and IgM is responsible for the primary immune response, having maximum molecular weight. They are having the maximum size present as a pentamer, also known as Millenniers antibody. So is it in the word IgM? It's Millenniers antibody. Which is the Millenniers antibody? It is IgM. IgD, immunoglobulin D, functions as B cell receptor. So the receiver of the B cell is IgD, and the IgE is increased in allergic conditions, also known as homocytotropic antibody. So the allergic conditions are responsible by the immunoglobulin E, also known as homocytotropic antibody. So we can give a small revision. What is IgG? It is present as maximum concentration in the human body, and which is secondary immune responsible and can cross the placenta. IgA, which is physiological secretions of the body, and present in the dimmer form joined by J chain. IgM, which is Millenniers body, known as the Millenniers antibody, important for the primary immune response, and having the maximum molecular weight, maximum size, and which is present as pentamer. What is IgD? Functions as the B cell receptor. IgE, which is responsible and the increased in the allergic conditions. So if you are having the allergy, the immunoglobulin E is the responsibility, and it is increased in your body. So the next one, natural killer cells or NK cells or null cells, and which is also known as non-T, non-B lymphocytes. Non-T, non-B lymphocytes. So the natural killer cells are also called as larger granular lymphocytes. Natural killer cells expresses CD16, CD56, CD8 and CD2. NK cells are capable of direct cell lysis, which is non-mediated by an immune response, and in which major histocompatibility is unrestricted. Does not involve an antigen-antibody interaction. The natural killer cells express activating and inhibitory receptors. The functional activity of the NK cells is regulated by a balance between signals from these receptors. Normal cells are not killed because of inhibitory signals from normal MHC class 1 molecules. If virus infections or neoplastic transformations perturbs or reduces the expression of class 1 MHC molecules, inhibitory signals delivered to NK cells are interrupted and lysis occurs. So the antigen presenting cells, these are the cells responsible for processing and presenting of the antigen to the T cells. So in the diagram you can see about the natural killer cell regulation of T cell immunity. So please, you can write down. So here we go for the macrophages. These cells have a role in induction in cellular immunity and effector in humoral immunity. They get activated by the presence of IFNY and are the effector cell in humoral immunity as the phagocytose opsonized microbes. The macrophage associated markers include CD13, 14, 15 and CD33. And what are the dendritic cells? These are important antigen presenting cells in the body and can be of the following types: interdigitating dendritic cells or just dendritic cells are the most important antigen presenting cells for initiating primary immune response against protein antigens. Immature dendritic cells within epidermis is called Langerhans cells. So guys, do you remember where you can see the Langerhans cells? You can see it is in the pancreas. Follicular dendritic cells are present in the germinal cells of lymphoid follicles in the spleen and lymph nodes. They are the storage or reservoir cells for HIV. So here we can discuss the major histocompatibility complex MHC or HLA complex. So it's very important. So please listen. MHC is a cluster of genes. The major histocompatibility complex is a cluster of genes located on short arm of chromosome 6p, whose main physiologic function is to bind peptide fragments of foreign proteins for presentation to antigen-specific T cells. It is classified into three classes, namely class 1, 2 and 3 genes. So, the major histocompatibility or HLA. The class 1 gene, which is comprised of HLA, B, C, E, F and G, code of major histocompatibility 1 molecule, and which is present on all nucleated cell and the platelets. So the MHC1 class 1 is comprised of HLA, B, C, E, F and G, code of major histocompatibility 1 molecule, present on all nucleated cell and the platelets. And what about class number 2 gene, comprised of HLA-D locus, code of MHC2 molecule, and which is present on B cell, macrophages, dendritic cells, endothelial cells and fibroblasts. The main points which are class 2 genes are present on B cells, macrophages, dendritic cells, endothelial cells and fibroblasts. Class 3 gene, which is the code of complement proteins C2 and C4 and TNF alpha and TNF, heart shock protein, propertine and 21 hydroxylase enzymes. So you can write on the chart and you can study by looking the chart, please. So here we go for the disorders of the immune system, the hypersensitivity reactions. These are caused by the activity of the immune system detrimental to the host in the response to exposure of the antigens to the immune cells of the body. These can be classified into the following 4 types of the reactions. The type 1 or anaphylactic type, immediate type of hypersensitivity reaction. It is defined as a rapidly developing immunologic reactions occurring within minutes after the combination of an antigen with antibody bound to mast cells in individuals previously sensitized to the antigen. It is commonly referred to as allergy. The first step is the stage of sensitization, followed by re-exposure resulting in development of symptoms. The important features of type 1 hypersensitivity reactions. The clinical features are usually seen during the second time antigen exposure subsequent to sensitization or priming. The cell critical in the pathogenesis is the mast cell. Histamine is responsible for the early clinical features because it is performed mediator. The IgE is the most important antibody to cause type 1 hypersensitivity reactions. Interleukin 4 is responsible for the secretion of IgE from the blast B cells. The interleukin 5 is the most potent eosinophil activating cytokine. Non-PAF is the major mediator of the late phase reactions. So, my dear friends, I am repeating the hypersensitivity reactions is very important. These are caused by the activity of the immune system, detrimental to the host in the response and the exposure of the antigens. The type 1 hypersensitivity reactions, which is anaphylactic type, immediate type of hypersensitivity reaction, and it is immunological reaction occurs within minutes after the combination of an antigen with antibody bound to mast cells in individually previously sensitized to the antigen. It is commonly responsible for all the allergic reactions. The first step is the stage of sensitization, followed by re-exposure, resulting in development of symptoms. The clinical features are usually seen during the second time antigen exposure subsequent to sensitization or priming. The cell critical in the pathogenesis is the mast cell. Histamine is the responsible for the early clinical features. It is preformed mediator. IgE is the most important antibody to cause type 1 hypersensitivity reactions. Interleukin 4 is responsible for the secretion of IgE from the B cells. Interleukin 5 is the most potential eosinophil activating cytokine. So you can see the table here, and it is very easy to remember. So my dear friends, you can pause the video and you can check out, or you can copy this to your notes and you can read about it. Thank you. And here we go for the examples of the type 1 hypersensitivity includes, and we can go for the two branches: localized hypersensitivity, systemic hypersensitivity. And in the localized hypersensitivity comes with bronchial asthma, hay fever or allergic rhinitis, food allergies, atopic dermatitis, urticaria, angioedema, Cassoni test for hydatidic cyst disease. And in the super systemic hypersensitivity, the anaphylaxis due to antibiotics, most commonly penicillin. Do all people know about the penicillin, which is mostly allergic? Antibiotics, most commonly penicillin. Therefore, a test dose should always be given before administration of penicillin to any patient. Bee stings, insect bites. So please remember this chart. And here we go to the type 2 hypersensitivity reaction. The type 2 hypersensitivity reaction is mediated by the antibodies directed toward the endogenous and exogenous antigens, which is present on cell surfaces or extracellular matrix. The effector mechanisms for this reaction include complement and Fc receptor mediated inflammation. When antibodies deposit in extracellular tissues, these activate complement system, leading to recruitment of neutrophils and monocytes. These cells also bind to the deposited antibodies via their Fc receptors. The activated leukocytes release enzymes, resulting in type tissue damages and the antibody mediated cellular dysfunctions. In this mechanism, The antibody is directed against cell surface receptors, impair or dysregulate functions without causing cell injury or inflammation. The examples of type 2 hypersensitivity reactions: transfusion reactions, erythroblastosis fetalis, autoimmune anemia, thrombocytopenia, Goodpasture syndrome, vasculitis due to ANCA, acute rheumatic fever, vascular rejection in organ grafts, myasthenia gravis, which is against acetylcholine receptor, Graves' disease against TSH receptor, pemphigus vulgaris against epidermal cadherin. Pernicious anemia, which is against intrinsic factor. Insulin resistant diabetes, which is against insulin receptor. So you can easily remember the diseases which is about the hypersensitivity to types reactions. So there is a mnemonic, easy one, you can remember. My blood group is Rh positive. So my means myasthenia gravis, blood means blood transfusion reactions, group means Goodpasture syndrome and Graves' disease, is means insulin resistant diabetics, IgP. RH means rheumatic fever, and positive means pernicious anemia and pemphigus vulgaris. So let's go for the type 3 hypersensitive reaction or immune complex disease. The antigen antibody complexes produce tissue damage, mainly by eliciting inflammation at the site of deposition. It is characterized by the formation of the antibody about days after introduction of the antigens. The smaller intermediate immune complexes are most pathogenic. The large complexes are rapidly removed by the macrophages. These immune complexes get deposited in the glomeruli, joints, skin, heart, serosal surfaces, and the blood vessels. Immune complex mediated inflammation is seen 10 days after the antigen administration and results in the development of vasculitis, glomerulonephritis, and arthritis. The blood vessels show intense neutrophilic infiltration and necrotizing vasculitis, having the presence of fibrinoid necrosis. So here are the examples of the type 3 hypersensitivity: localized hypersensitivity and systemic hypersensitivity. So the localized hypersensitivity diseases are Arthur's reactions, Farmer's lung, hypersensitivity pneumonitis, polyarthritis nodosa, and in systemic hypersensitivity, SLE, reactive arthritis, post-streptococcal glomerulonephritis, serum sickness, and the type 2 leper reaction. And we have a mnemonic to remember the type 3 hypersensitive reaction disease. It is a sharp. S means serum sickness, or ESLE, systemic lupus erythematosus, and H means hypersensitive pneumonitis, including farmer's lung and Bisnos or Henoch-Schilling purpura (HSP), and E Arthur's reactions. R means reactive arthritis, rheumatoid arthritis. P means polyarthritis nodosa, PAN, post-streptococcal glomerulonephritis. Let's go to type 4 or cell-mediated hypersensitive reaction. The cell-mediated type of hypersensitive reaction is initiated by antigen-activated T lymphocytes. It includes the delayed type hypersensitive reactions mediated by CD4 T cells and direct cell cytotoxicity mediated by CD8 T cells. The pathogens of delay type hypersensitivity reactions. The first step is the entry of the antigen inside the body, where it is captured by the APCs and presented to the T cell, which then differentiates into Th1 cell. The sensitized Th1 cell enter the circulation and remain in the memory pool of the body. When there is re-exposure of the same individual to the antigen for the subsequent time, there is release of cytokines like TNF alpha, lymphotoxin, IFN-Y, interleukin-2 and interleukin-12. The TNF alpha and lymphotoxins have effects on endothelial cells, leading to extravasation of lymphocytes and monocytes. IFN-Y cause IFN alpha cause activation of macrophages. Interleukin-2 cause proliferation of antigen-specific T cells. Interleukin-12 is produced by macrophages and dendritic cells and is critical in the pathogenesis of delayed hypersensitivity because it induces the Th1 response. The collective release of these mediators is the formation of a granuloma. Pathogenesis of T cell mediated cytotoxicity. The cytotoxic T lymphocytes cause destruction of antigen bearing target cells, particularly the tumor cells and the virus infected cells, through activation of apoptosis by either the activation of the Fas system or perforin in granzyme depending killing. The examples of type 4 hypersensitivity include tuberculin reaction, lepromin test, multiple sclerosis, chronic graft rejection, contact dermatitis, sarcoidosis, type 1 lepra reaction, tumor immunity, resistance to viral infections. So my dear friends, we can discuss about autoimmune disorders. It's very important. In the image you can see the different diseases, antigen, pathology, and you can note it down in your notebooks. So here we start with the systemic lupus erythematosus. It's very important. Systemic lupus erythematosus is an autoimmune multisystem disorder of abundance of SLE.